Hello, my name is Caitlin Loggins, and today I'll be doing my adolescence assignment for my Psychology 210 Human Growth and Development. So if you're not my professor or my proctor, please scroll on. Today I'll be discussing the physical, cognitive development, and sexual maturation in adolescence. Puberty is a period of development that begins in adolescence and ends in early adulthood. The typical age range is 12 to 18 years old, and there are some predictable milestones in this stage of development. Rapid growth in sexual development begins at puberty, sometimes between the ages of 8 and 14 years. Although the sequence of physical changes during puberty is predictable, the onset and pace of puberty vary wildly. Every person's individual timeline for puberty is different and can be primarily influenced by hereditary. However, environmental factors such as diet and exercise also exert some influence. Puberty involves distinctive physiological changes in an individual's height, weight, body consumption, circulatory, and respiratory systems, and during this time, both the adrenal glands and the sex glands mature. These changes are largely influenced by hormonal activity. During puberty, men gain muscle at a much faster rate than women, while women gain more body fat and their bones become harder and more brittle. At adolescence, heart and lungs increase in both size and capacity during puberty. These changes can contribute to increased strength and tolerance for exercise. During puberty, primary and secondary sex characteristics develop and mature. Primary sex characteristics are organs specifically needed for reproduction, the uterus and ovaries in females and testes in males. Secondary sex characteristics are physical signs of sexual maturation that do not directly involve sex organs, such as the development of breasts and hips in girls, and the development of facial hair and deepened voice in boys. The development of pubic and armpit hair, as well as the development of sweat glands, occur in both men and women. The male and female gonads are activated by the surge of hormones discussed earlier, which puts them into a state of rapid growth and development. The testicles release primary testosterone and the ovaries release estrogen. Production of these hormones gradually increase into sexual maturity. In adolescence, changes in the brain interact with experience, knowledge, and social demands and production rapid cognitive growth. Changes in how adolescents practice developing abstract and hypothetical thinking skills and the way they interpret information alternatively. The changes in teenagers' thinking, reasoning, and understanding are even more noticeable than their obvious physical changes. Piaget used this stage of cognitive development, the formal operating stage, which marks the transition from the ability to think logically and reason about concrete, visible events only to the ability to think logically and abstract concepts. Adolescents are now able to analyze situations based on cause and effect logic and consider hypothetical situations and consider different possibilities in the world. This higher level thinking allows them to think about the future, evaluate alternatives, and set personal goals. Although there are clear individual differences in adolescents' cognitive development, these new abilities enable adolescents to engage in introspective and mature decision making that were previously beyond their cognitive abilities. There are two perspectives on adolescent thinking: constructivism and information processing. The constructivism perspective, based on the work of Piaget, takes a quantitative stage theory approach. This view hypothesizes that adolescents' cognitive improvement is more than sudden and drastic. The information processing perspective derives from the study of artificial intelligence and explains cognitive development in terms of the growth of specific components of the overall processing of thinking. In the last of Piaget's stages, children can reason not only about tangible objects and events, but also about hypothetical or abstract objects and events. Hence, it has the name formal operating stage, the period where the individual can operate on forms or representation. This allows an individual to think and reason with a wide perspective. This stage of cognitive development termed by Paget as formal operating thought, marks a movement for an ability to think and reason from concrete visible events to an ability to think hypothetically and entertain what-if possibilities around the world. So there are many changes that go on, and Paget's theory helped us to understand them.